The Philippines once again saw a record high in COVID-19 cases today at over 22,300, pushing us closer and closer to the grim 2 million mark in total infections. To share with us his insights, Professor Guido David of the OCTA Research Group is now joining us over the phone. Good afternoon, Guido. Thank you so much for joining us again. First off, I wanted to get your initial reaction to the case bulletin today. You just, of course, said we might hit 20,000 at around lunchtime in the Laging Handa briefing. Was this expected?
Well, I mean, it's, I would say it's in the upper range of the estimates that we were expecting. So this is obviously not a good number. It's higher than what we, it's on the upper side of what we were expecting. The reproduction number has increased to 1.39 in the country. And we're expecting somewhere in the neighborhood of 6,000 cases today in the NCR. Once we see the breakdown, well, the only upside is that tomorrow's a Tuesday, so we're expecting a dip down to 14,000 on Tuesday.
All right, having said all of that, will you guys be doing any adjustments in your current with your current projections or perhaps your current calculations? Are you going to, or are we going to be seeing daily cases surpassing 25,000 anytime soon?
Yeah, well, definitely 25,000 is the next, you know, I would say, I would call it a milestone, but it's the next level that we are, you know, sort of looking at. So we will have to, yeah, you're correct. We'll have to make adjustments on the numbers, on the trends and the projections. Probably not this week. It's probably not going to hit 25,000 this week. But we will have to reevaluate if there's a chance that we'll hit 25,000 next week.
Right, perhaps this is not the right thing to say, but I am looking forward to your new and recalibrated calculations. Guido, you also previously said that the reproduction rate, at least in the NCR, is slowing down. However, we are still seeing record cases. Can you talk us through how this is possible, just to clear it up, the math behind it?
Well, when we look at the breakdown, what we see is that we were getting record high numbers in Cavite and Laguna last week, and also in Cagayan. So there are some areas, particularly near the NCR, which are seeing record high numbers, and the reproduction numbers very high, or even accelerating or increasing. So these are adding to the large totals that we are seeing right now in the country.
All right, I guess I'm going to have to ask you whether or not the 2-week ECQ and extended MECQ periods, if they were enough to mitigate the surge, did it work in short? Or should the government now revisit classifications and strategy?
I think the government should definitely at least you know, sit down and re-examine, you know, classification strategies and maybe think about priorities, especially now that we are hearing that, you know, healthcare systems with, you know, boycott going on and people resigning, you know, it could be on the verge of collapse. We're seeing, I mean, even though the numbers are not yet record high in the NCR, we're actually already seeing record high numbers in terms of ICU occupancy and hospital bed occupancy. The ICU occupancy right now in the NCR is 200 beds higher than last April. So there are some things that that could be problematic down the road. And I would have to say it, but if the government really wants this to slow down, I mean, I think they know what they have to do. I mean, if we're just looking at the public health aspect of it.
Right. The government's also proposing, or at least some proponents in government are proposing, that we shelve wide-scale lockdowns and shift to granular lockdowns in the meantime. In the light of the numbers, Guido, do you think this is still possible or will be effective?
Well, if they're thinking about MECQ with granular lockdowns, that should be more effective. But if they're thinking of downshifting to a GCQ with granular lockdowns, it might have unintended consequences because we have, I know that we have tried granular lockdowns. We tried the GCQ with heightened restrictions with some granular lockdowns in the past, and we saw that the numbers ballooned. So, and just to reiterate, the 2-week ECQ was actually effective. Yes, the cases did reduce, but the reproduction number decreased, and that's what we were counting on to happen. If the reproduction number is starting to increase now, that would be an indication that our current interventions are not working.
All right, it's also been several months now since we rolled out vaccines and vaccine drives. Have we actually felt the impact of vaccinations, especially under this most recent ECQ period where we really ramped up vaccination? What are your thoughts on this, or what do the numbers say?
Well, Sean, this may be hard to believe, or people may find this hard to believe, but vaccinations did actually have an impact. And the reality is the surge would be a lot worse if we did not have vaccinations. It would be a lot worse than what we had in April. I mean, even especially in the NCR, we could be seeing, record high numbers in the NCR. So we're already feeling the impact of vaccinations. But unfortunately, even those vaccinated cannot be complacent. They still have to follow health protocols. Why? Because vaccinated people can still be spreaders. And there will be some breakthrough infections, although preliminary data that we're looking at shows that breakthrough infections for vaccinated people is actually at a very acceptable level. And it shows that the vaccinations do work in preventing severe COVID. But at the same time, we're still seeing record high numbers of ICU occupancy. So it means that a lot of people are still getting infected with severe COVID. I mean, I can't say right now if it's mostly due to the unvaccinated, but we'll have to look at a bigger set of data for that.
All right. Well, with the current set of data that you do have, can you share with us perhaps other observations when it comes to trends, especially as cases of Delta are continuously rising with gene detection? Anything interesting coming out of your trends and your numbers?
Well, we know that the Delta is dominant already in the country. Latest genome sequencing shows that it's about 70%. So if we're taking 70% of 22,000, that would be somewhere around 16,000 cases today with the Delta variant. And that would be, I mean, if we think about it, that's a lot. And most of the transmissions are most likely the Delta variant, especially in the NCR. So I wouldn't be surprised if it's, much higher than 70% in the NCR. And this is, this is hard to stop. We know that because we have seen this in other countries, in India, in Indonesia, in Thailand. So, we really have to do something about this, or else if we don't, we'll just, the population will just, the Delta variant will just rampage through the population.
Right, and a lot of people are saying, of course, that is the nature of viruses, to ravage through the population. Any sort of estimate or guesstimate as to when this will hit critical mass?
Well, I haven't looked at that number, Sean. I'm honestly afraid to look at it because, when I see really high numbers, it gets really depressing. But maybe, as you said, we'll get back with you on that one.
All right, I can't exactly say, looking forward to that, but I am interested to see what you come up with. Thank you, as usual, for your time and your insights. Professor Guido David of OCTA, thank you.